Hi everyone, it's Dr. Jeff here talking to you about exercise and pregnancy. Lots of questions on and myths about exercising when you're pregnant. There's a group called the Center of Exercise and Sports Physiologists that have done lots of studies on this, and they come up with a protocol. If you want to go visit it online, it's called Paramedics, P-A-R-MDX for pregnancy. Lots of good information there with that. But exercise is important during pregnancy as it is in regular life. Why is exercise so important? Well, one is for fitness. The fitter you are before you're pregnant, the fitter you're going to be after you're pregnant. So it's just good for overall lifestyle. But also energy levels. One of the big things with being pregnant is you're tired all the time. One thing I found is that people with exercise, and if you're exercising you're pregnant, it helps with your energy levels, boost your energy up a little bit. Also weight gain. It helps control your weight gain, and this also leads to control of gestational diabetes. One of the problems you get with pregnant if you get too much weight is you can get gestational diabetes. So it's a good way of controlling that. Also getting ready for labor. Labor is very difficult for the mother and for the baby. And they found that the fitter you are before the labor, the easier your labor is going to be. They also found that for the baby, that when the mother exercises, the heart rate for the baby also goes up as well. So you're actually training your baby as you're training yourself. So the baby's actually in better shape to get through the trauma of the delivery. They've also found for some reason that babies with fitter mothers actually are smarter. I don't know why, but that's one thing they found. They also found that muscle tone is a big issue, especially postnatally. Mothers will tell you that after delivery they have problems with their bladder or with some pelvic floor issues. By actually exercising during pregnancy and building up the strength of that pelvic floor really helps afterwards with controlling some of these issues. Well, is there any side effects to the baby? Well, if you're doing strenuous exercise, if you're burning up all your glucose, you're also going to be burning up the glucose for your baby, so your baby can actually get glucose deprivation. Also, oxygen-wise, if you're breathing really heavy and you can't get enough oxygen, your baby's going to be fighting for oxygen as well. So that's why we try and avoid strenuous exercise when you're pregnant. But when should you be exercising? Well, if you've never exercised before, starting in your first trimester may not be the wisest thing. If you've exercised before, just continue on with your normal type of routine. One thing they do suggest is try and avoid contact sports, so hockey or even horseback riding, things where you can hurt yourself or you can get abdominal trauma, things like that. You may want to think about avoiding, but just continue on your regular routine. If you've never exercised before, then starting your first trimester, just starting with walking, something very simple. There's something called the walk-talk test. So when you're walking, you want to make sure you can actually carry on a conversation. That just means you're exercising at a mild to moderate level. When you're exercising, that's where you want to be. You want to overheat, because in the first trimester, one of the big things is something called the neural tube in the fetus. And that's kind of like the spinal cord, and that's when it's developing. What they have found is that when women get overheated in the first trimester, that leads to complications with this neural tube actually closing. So this is when they suggest, no hot tubs, hot yoga, saunas, going out for a run when it's really humid outside, things like that. So you don't want to overheat, especially in that first trimester. So also when you're exercising, you might want to make sure that you've got a snack and water close by, because again, you've got two people inside you, so you want to make sure that you've got water and snack and you're not going to get dizzy. As far as exercising is concerned, it's very important when you're pregnancy. If you want to go visit the Paramedics website, that's a great source of information. I'm Dr. Jeff. I've got your back.